Welcome to Frankly Speaking with Dr. Wade. This show was created for and inspired by the thousands of patients I've served, so it's time for me to speak up and speak out on their behalf. With a wide range of experts, we bring you weekly insights, diving deep into topics of controversy to bust through the sugar coating that keeps you and your family stuck in the mainstream. Hey everybody, I am here today with Dr. Skip Wyss. Wyss, thank you. Yes, looks like Wyss, sounds like Wyss.
Right.
R-E-E-S-E sounds like. So it's W-Y-S-S. Dr. Skip Wyss is a fantastic chiropractor who's been out 10 years in the Green Bay area, so home here in Wisconsin. And we crossed paths by his, well, first of all, it was his attire. As you can see, he's a classy dresser. Actually, that was not it, but he turns out to be that too. So he's a great pediatric chiropractor who not only has a passion for kids that you'll see, he's pretty sharp dude. So we're going to talk about, first of all, how he got to this point and why he is now being requested as a speaker on a number of platforms, and also why he's like fire hot right now on topics with chiropractic, and then how we can better improve the quality of life of our kids in the United States and the world. And so we want to do that not only ethically, we want to do that by using science, by being real to what's there and actually support that. So we're going to pick Dr. Skip's brain today and talk about some things like, first of all, Dr. Skip, thanks for being here with us.
You're welcome.
And taking the time with some, as you can see by the clock, some audio and technological challenges that seem to go with like every broadcast. Yep. So here we are. So thanks for being here with us today. First of all, how'd you find chiropractic, and how'd you get into it? What and why?
So I'll give you the elevator version, the 90-second. Okay. So basically I've been adjusting since I was a kid. About 2 years old is when my mom started taking me into the chiropractor. She worked for a chiro for a number of years. I started developing weird things when I was a kid. They diagnosed me with migraine headaches of the stomach, which I find ironically, I just got a patient in the other day diagnosed with the exact same stuff, same diagnosis they used over 20 some years ago on me, and actually 30, I'm 36. So, mom starts taking me in, and then lo and behold, in high school, as I'm adjusted throughout my whole life, I blow my knee out playing kickball and weightlifting class in high school. And I lose my career in football. And as I'm being taken by an ambulance to the emergency room, I go to the emergency room, and the emergency room doctor pretty much, kind of call it doc in the box. He's messing around with my knee, tells me I've got some swelling in my knee, even though it's the size of a grapefruit. And like Doctor 101 is compare good side to bad side. You know what I mean? So You can visually see that there's no kneecap. So there's swelling, boss. But he sends me in for x-rays and then puts me in mobilizer, tells me I'm not going to see my GP for 2 weeks, go home, ice it. As I'm leaving, my dad asked me what I want to go do, and I said, I absolutely need to go to the chiropractor. And we went over and saw my mentors, and, John looked at my knee, Dr. John Stowe. These guys are in Black River Falls, Wisconsin. So that's Dr. John Jordan, John Stowe, and then at that time, Dr. Danny Ariati was there too. And those guys are my mentors and kind of pushed me into chiropractic because they looked at my knee. John looks at it and says, Skip, I can't tell you exactly what's going on tonight. You're going to get adjusted. You're coming back tomorrow morning, and we're going to look at this knee because it was so swollen up. We had to get some swelling down. And I go in the morning, and I'm face down on the table. He's looking at my knee, and he's like, hey, you got a blood blister back here on the back of your knee. Your knee's definitely tore. He goes, I don't know where yet. We'll figure that out. But he said, knees just don't bleed internally for no reason. And I was like, okay. So at that point, I knew that I wasn't playing football ever again. And this is my junior year in high school, by the way. He sets me up, and this is on a Friday. And by Monday, I'm in to see the orthopedic surgeon. And that's the case. And that's when I realized that chiropractors are more than just a guy that manipulates the spine or adjusts me and makes me go pop and makes me feel good for a day. Like, I never really fully understood what chiropractic was until at that moment I started realizing that Dr. John was a little bit more than just Dr. John, the chiropractor. And what happened then is through physical therapy, I started squatting a ridiculous amount of weight about 8-9 weeks in. And this is after I had my knee scoped, and they found that I had a torn ACL, PCL, and LCL. They didn't actually replace anything. The PCL is completely ruptured still to this day. The ACL saw like a grade 2 tear, and the MCL or LCL. LCL? Yeah. No, I can't remember. One of the laterals is about a 1 degree tear. So it's not, my knee is still stable, but I'm squatting, right? And I squat this about 500 and some pounds of weight, and the physical therapist at the time looks at me and says, "You can't squat ever again because your knee looks like it's going to fall out the front." I'm like, "Okay, no more squatting." And he's like, "Why do you think, Skip, that you are progressing so much faster than everybody else here? Because we don't see knees rehab like this." And I thought to myself, and I looked at him, I said, I've been getting adjusted 3 times a week since I tore my knee up. And I just go because it helps me and it makes me feel good. But I said, I'm almost positive this chiropractic thing that I've been getting done is really helping me rehab and really helping me heal. And he looks right at me. He doesn't even skip a beat, Dr. Wade, and says, "You honestly think your chiropractor, when he adjusts your neck, affects your knee?" And at that point, I knew that I wanted to be a chiropractor because everything about that statement just didn't ring true to me at all. And to sit there and belittle another line of healthcare because they don't understand what we do makes no sense. And now I know right now that it's a direct effect as to why I heal. And when I had my knee scoped a couple of years ago when I tore my meniscus, I'm sitting with the best surgeon in Green Bay. And he's looking right at me. He goes, "You don't have any swelling in your knee, like you're working already. What's the deal?" I said, "Dr. Patty, I'm getting adjusted. My wife's taking care of me. I got a low inflammatory diet." He's like, "Exactly." He goes, "This is exactly why you're healing so quickly." And I said, "You get it?" He said, "No, I know I get it because the brain is what heals the body. And as long as it's in full communication with the body, it's going to heal faster and more effectively than any other time in its state." And I said, "Exactly." So back to this story. So I decided I wanted to be a chiropractor. And John approached me about it, took me down to Palmer. I went to my first homecoming at 18, had the goosebumps just stand up on the back of my spine the minute I walked onto that campus, kind of like falling in love when I met my wife for the first time. And I knew that was where I needed to be, and that's exactly what I needed to do. So I knew I was going to Palmer from that point forward. And so the story wrote. And then I graduated in 2008, and now I've been in practice for over a decade with my wife, Dr. Julie. And we've been just hauling into pediatric since we hit the ground running. And the pediatric world is where we need to be. Okay,
awesome. By the way, that's such a cool story. I love hearing the reality of how many of our colleagues have gotten into the profession. It's by default in many cases. And I say that very respectfully default, meaning we've had to overcome something. For me, I was a kid too at 4, you're having chronic ear infection. So started getting adjusted and boom, my life changed. And I didn't feel like I chose it. It chose me because I just knew that's what I was going to do. And maybe because it was different and I came from 7 kids and wanted to be a little different. Okay. And the other thing is it doesn't matter because I couldn't see the body differently once I was influenced like that. It just made sense. So shifting gears, you were profoundly affected. You got to experience the magnitude of what healing is like, and then the contrast. And that's what I think oftentimes, we in our profession tend to forget is the contrast with because we're around this, we see through that lens, we see through the body as self-healing, self-regulating, driven through that master system, the nerve system. But we forget the contrast that patients are up against many times, which is the confusion. Like they don't get the support from their other providers that it even makes sense. And it doesn't help them solve that problem. In some cases, they start to learn, like you, more about themselves that, well, I guess how I see it as the patient sees it, they either have to they feel like they're working against what their provider believes, which sets up this confrontational imbalance, or they buy into where that theory comes from because that might be the quote unquote majority of the opinion. And so what I love about what you're not even trying to attempt, what you are doing is increasing the awareness and the quality level. So share with us the pediatric side, like the passion you have in the influential part. I think many of our peeps watching, our listeners, and subscribers are open to alternative care, of course,
right?
But they want to feel more supported. They want to feel more supported by, number one, science, something logical, something cost effective and realistic. Can you spin how or pivot towards kids now, how that impact and where it's measurable? Like, where do you see objective measurements and where does it contrast? For example, how does it contrast and work with pediatrics, like medical pediatricians?
Yeah, that's a loaded question. Okay, that's an awesome question. So let me phrase it. Let me go about it and answering it in this way. Number one is what drives me hard is the fact that the story that you just told about yourself and about myself is that we had something tip the scale that pushed us into chiropractic. Something had to come along and actually change our life in order for us to go into this. My goal now is to grow the profession so hard from within, from kids, that they don't have to have a life-changing event to know that chiropractic is the reason why they're as healthy as they are, and they choose a profession based on that's what they know is normal. And instead of having to have a life-changing thing where I blew my knee out, I've been going, but now all of a sudden a chiropractor is like, you should become a chiropractor. I'm like, oh yeah, that makes perfect sense. But to have that force with them since they were born, since they're put together, since when they're delivered, and we check them after delivery, and that's what they know as a normal way of life. There's no other way around it. They choose a profession because of what it's done for them their entire life instead of having a life-changing experience. That's what drives me now with kids, is because I want to grow this profession. We need to have people that have been in it their whole lives and can push forward so they can sit on the shoulders of giants that have come before us and keep driving forward, because that's what drives them. See, when we look at kids now, and you're back to your question, is saying, how do we measure these outcomes? Well, we look at it from an exam perspective and to constantly go back to the well and constantly check their functioning and their neurology. That's key. And the reason why people feel like they're going against the grain when they deal with their medical doctor is that it's an inborn, innate sense to protect oneself and to always heal from inside out. That's a huge thing. And when they're in a system that is constantly shutting things off to try to get something to turn back on, doesn't make any sense. So when we have a kid that comes in with ear infections per se, okay? And so what we do is we're going to give them antibiotics, and we're going to try to, medicine's going to try to kill that antibiotic, kill that virus through antibiotics, okay? Either it's going to be amoxicillin or an upper respiratory infection med that just gets stronger and stronger and stronger. But what's happening is they're trying to stop a system from expressing symptoms. That's the whole key, is if we can control the symptoms, therefore they're healthy. And that isn't going to work. And that's the thing about a chiropractic, is we turn things on. We turn the immune system back on. We get it better functioning because the brain is what controls that immune system. Okay, and the midbrain is actually what controls it even better. And if we're constantly trying to inhibit the immune system with an antibiotic and trying to kill it synthetically, kill the virus synthetically, the body can't express life and it can't move itself forward. So in kids, what happens then is we get them on a chronic run of antibiotics. And most of us will get in kids, and Dr. Wade, you can even attest to this too. I know you've seen a kid come in that's been on 10 different medications for ear infections that he's had, and he's had 10 ear infections in the last 8 months. How is it okay then to say, let's add a drain into the ear, which is what it does. And there's nothing with tubes. They're adding a drain to the bathtub, but they're not keeping the bath water from getting dirty. So if I add an extra drain to a bathtub, it drains the water faster. But it doesn't stop the bath water from getting dirty when the kid gets back into it, when he needs, you know what I mean? Nobody gets in super clean. That's the point of health, okay? So that's what happens. So we start adding things in or taking things away instead of getting the immune system to thrive exactly like it's supposed to. See, chiropractors at times kind of miss the boat just a little bit with ear infections because we assume that we're just helping the eustachian tubes drain the ears. And that makes us no different than an ear tube. And what we're trying to do is treat the ear infection, when really what we're doing is returning the nervous system back into full communication with the body. Therefore, now the immune system can run faster and it can run more efficiently. And it can get out and find the virus and kill it. Or actually, God forbid, raise the temperature up to start slowing down the replication of a virus so the body can then kill it even quicker. And that's why chiropractors are so damn effective with ear infections, because we get the immune system turning on to running at its full potential. And that starts with gut running better, which is controlled by the low back. That starts with the that ends with the immune system running better because it starts with the upper neck. So if we have two areas that are in constant alignment issues where we're not talking, we're subluxated in both areas, that's a double-edged sword that'll slow down that immune system and cause a myriad of problems with that child. So what do we do for measurables from that point forward? Are we looking at immune system function? We're looking at neural function. So we're going to do scans on children. We're going to do neuroscans. We're going to do an actual bulletproof exam on them and check all of their primitive reflexes, check their posture, check their balance. All of that showing us the body's left us a bunch of checks and balances in the body. And if we're checking it with a proper exam, doing a really good, excellent exam, not just a thermoscope up their back to check temperature change, okay? But we're actually doing a really thorough exam. That helps us delineate what's going on with children. And then we can go back to that exam and see what systems are turning back on as we reevaluate and adjust that child. Because we know that the brain's going to turn on the body and run the body.
Okay, I want to stop you there because I want to add some clarification to those viewers. I love it, first of all. I'm completely with you. A couple things I just wrote down just for reclarification. First of all, antibiotics delivered to that child, 5, let's just say 1, 3, 5, 10. How many times, in your opinion, do they actually run a test to determine whether it's bacterial or viral? They still give an antibiotic.
Right. And it's straight up off of vision. They will go in with an otoscope, look in the child's ear, and even if it's inflamed, they will give them an antibiotic. And either it will be an internal antibiotic to take, or they will recommend external antibiotics, which is drops. And that's still going to cross membrane tissue in the ear.
Yep.
So they're still being exposed. So it's all based off of vision. They're not running the test. And if they do a blood test and they see that white blood cells are up, they're going to assume infection. But they will always assume bacterial. I've met very few MDs that will assume viral right away and not want to prescribe a medication. And that's actually a really, really breath of fresh air when I do have a chance to meet them, because they're looking at it the same way we do, where they're like, viral infections, antibiotics are not effective against a viral infection. And they'll
repeat that.
Antibiotics are not effective against a viral infection. It's a virus. It's not a bacteria. Antibiotics are designed to kill bacteria. Beautiful. So if we go in and we take an antibiotic, it's going to affect bacteria across the board. It's not going to affect just some sort of bacteria that's actually causing the upper respiratory infection. It's going to affect all bacteria, and it's going to infect the gut, because that's where our bacteria is. Okay? And the adage is roughly 3.5, that an adult has about 4 to 4.6 pounds of bacteria in their gut at any given time running their body. So if we start putting antibiotics into that system, we start dropping the system down. Now let's think of it from another way. If we have a 150-pound adult, okay, that's 2% of their body weight is bacteria. If we start cutting that down, that's shutting down a very, very intricate system that's running our body and helping keeping us alive. That's a serious issue. And the thing is with that, though, is those bacteria run with neurology, because the neurology of the low back controls that gut. And if that gut gets inflamed and those little hairs in the gut can't beat and move and actually move that bacteria properly, that bacteria dies. Just like any other cell in our body, if we don't have motion, it dies. And we need motion, we need life to keep that moving. Does that make sense?
Oh, absolutely.
Yeah.
And I think, most people are now aware that if they take most people are now aware that if they take an antibiotic, they do want a probiotic to follow up. And then some are actually trying a probiotic along the way, which is a great awareness shift. It's a great way to look at things now where, people are more understanding of that. So what I really didn't want to have people miss is that even though they're doled out, because they're just, again, the contrast is patients, my doctor gave it to me, therefore it's the right thing to do. My medical doctor prescribed it, therefore I should do it. And I was in that same pattern where antibiotics, well, we didn't try them for that long, but because my mom, we were using drops and things, heating pad, and just trying to do alternatively, but the pattern wasn't going away. So it's time to get adjusted. And then boom, everything changed. And that's the only thing that helped. And at that point, they wanted to put tubes in my ears, which was, and my mom, thank God, she was a stubborn German woman, basically said, That doesn't make any sense. You're not telling me why the infection's there. You just want to put a hole and let it drain, and then nothing really is changing in that immune response. Thank God she had questions and then, asked a better question. So back to the contrast of what patients kind of feel like, hey, my doc says this, so therefore, and now you're saying that, and they're stuck in the middle. And that's what this is about, is helping people get unstuck from that confusion and start to think and see their body more logically as to here's what your body's really trying to do. So when you talk about, I don't want to completely get away from, but it seems pretty basic knowledge right now, is if we, talked about the gut flora, which is great. And you're right, we want to reestablish that. But like when you're talking about why would, many of our parents don't realize why it's important to get their child checked. So if they're not having a knee pain or knee problem or back pain as a little athlete and gymnast and dance, why would a parent consider getting their child checked, and at what stage? Because the biggest question I hear is, what do you mean after birth? They don't have back pain.
Right. Children should be checked as soon as they're born, because birth is usually the area of the body interruption, of an interruption in the nervous system where the interruption actually occurs is during birth. And the reason why is because of the passage through the birth canal, or if they are pulled out via forceps, pulled out via vacuum, or harvested with a C-section. Okay. All of those cause trauma into the body. And that is a serious, serious thing, because if you picture the occiput is sitting, so the base of the skull sits with the first vertebra in the neck. Okay, so the base of the skull sits with the first vertebra in the neck, and they sit together very, very tight. They're like two bowls sitting in your pantry. Okay, and when you go and lift, when that child gets pulled out, the first vertebra in the neck stays with the skull and goes up. Number two, the second vertebra in the neck goes with the rest of the body and pulls down with gravity. And that causes a traction of the first vertebra in the neck, the skull together, from the second vertebra in the neck. And just that alone will start to cause nerve interference when the baby's just left back into place and now meant to go through the rest of its life with that much traction happening in the first few moments of life. And here's the thing. You see, when the body's being put together at about 20 days old or so, the nervous system is coming fully online and putting itself together inside mom. And then from that point forward, it's running a very, very precise and intricate program, and it's bringing on all of these different reflexes to keep your babies functioning, to keep them running properly, keep them rooted, keep them latching, allow them to feed, allow them to digest food, allow them to come out sympathetic. So allow them to come out protecting themselves, which they do, because if they come out fully open, they expose all their organs. So if we look at that alone, babies are supposed to come out flexed, and then they open up due to Moro's response. That's the reflex. That's that wonderful startle reflex that when you clap over a baby or you move them really quick, they spasm out. Or every parent's dealt with this. You go and put them in a car seat when they're asleep, and all of a sudden they spaz out and open up and they're awake. That's their Moro's reflex kicking on. That's a good reflex to have. But that's online at 10 weeks in utero. And then if we fast forward 30 weeks and they're born and all of a sudden that reflex is delayed, what caused that delay in that reflex? It's the birth. It's the trauma of birth and baby passing through birth canal, so they need to be checked. The other thing is that directly will have a linear effect on their health going forward for the next 2 years of life, because that's where most of the brain development happens, is in the first 2 years of life. Most of the skeletal structure is going to come online. And if you look at any SOT research or Desjardins research, you will see that there is a direct linear effect on children's health if they're adjusted before the year of 2. Before the age of 2, there's a direct linear effect on the positivity of their health from that point forward if they're adjusted before 2 years old. Because from 0 to 2, that's when they start developing all of their neural habits. So all the habits that run their whole body are being developed from 0 to 2 years old. They need to be checked at that point. They need to be checked by a chiro that actually understands kids very, very well and knows what's going on with that baby. And that's not a knock on chiros in general. I mean that with so much love, because I deal with a lot of chiropractors. If we're going to deal with kids, we need to know what we're doing. We need to be very, very on top of things. Just like dealing with athletes. I don't pretend to deal with professional athletes all the time, because I'm not I don't have my certified chiro sports prac. Like, we've talked about this, like dealing with professional athletes, Total different ballgame.
Right.
Than it is dealing with kids. Just like if you deal with adults all day, trying to take care of a child is totally different. Their anatomy's smaller. Everything's different. Nothing's ossified fully yet. There's tons of growth centers. In fact, I think I read that there's about 66 extra bones in a baby because nothing's all ossified together.
Right.
There's small growth centers everywhere. So we have to understand all of that. And we have to know that when we adjust those babies and we adjust those small spines, they need very, very special and intricate adjustments that work on tone and don't work on osseous manipulation. There's a total difference there. And getting the tone back to the spine is absolutely key. And that's the communication between the brain and the body. It's founded on tone. It's founded on the specific communication between the brain and the body.
Can we elaborate on that just a bit for non-doc listeners, and we get both on this. So I just wrote 0 to 2 neural habits. I think it's so powerful. I've always seen a lot of kids in my office. Yeah. It's something that is not only just dear to my heart, but it's this impact on health down the road. And it bothers me, as it does you, when you hear a medical doctor say, well, don't have them get adjusted. It's based on no literal founded evidence other than a generic opinion as to what it is we do or how we do it.
Right.
And so that stance of ignorance is very disturbing to a parent who then, a confused mind always says no, which means if that parent can't be supported, because I'm not saying don't see a medical doctor. I'm saying you can't let that be your driving answer to health. It is just not going to get you to health, period. You want some other opinions, such as a knowledgeable chiropractor that can give you answers and actually support it as to why. For example, what your child's experiencing, which Dr. Skip is talking about, is measuring in that first stages. He's literally measuring reflexes that are neurologic that make way more sense because the patient can say, let's say mom or dad says, well, their pediatrician says they're fine and that they're spitting up just because of that. So we need to give them PPI at 1 day old. And it's just disruptive. But what I'm trying to open up is they might feel like everything's okay because they were told everything's okay and that they're not referred to a chiropractor. Therefore, that's not needed or even beneficial or even necessary.
Yeah. And it's seen as it's a different paradigm. And I can't stress that enough to parents. It's a deductive paradigm versus a vialistic paradigm to turn things on to get the body to express life versus shut systems down just because they're overreacting. It's kind of like, okay, so let's say we're driving down the road in our car and our check engine light comes on. Or no, let's say our oil light comes on because that means like catastrophic failure. Like if your oil light comes on in your car, you better pull over and shut your car off, right? Yes. That's all they'll do then. So if the oil light comes on, I'm going to pull over and shut the car off. Therefore, everything's safe because the car's not running and the oil light's not on. Everything's okay. Yet we know the internal components of that engine, if the oil light's on, have either oil overheated or there's no oil left in the engine and it's completely seized itself up if it hasn't shut down already. So we have to actually get a mechanic involved to fix what's going on and restore that. You don't go out and buy a new car. You shouldn't. You should have somebody come and fix your car and make sure it's running properly and then drive it down the road. Well, the thing is that if all we're going to do is ignore the light, and we don't see the light anymore, obviously everything's okay, and that's a bunch of garbage. And what's that? Yeah, you just cover up the gas light or the oil light, and you pull over and you just walk away from the car. I'm not walking away from a car. I love cars. Doesn't matter the year, okay? And I'm not walking away from children because giving them a medication and shutting off a system in their body is simply just giving them a Band-Aid and walking away from it and then telling the parents they're going to grow out of it. And kids never grow out of anything. They grow into the next problem. That's the issue.
El Doctor, we need to address that grow in, grow out, because as I was a kid, I have a few years on you, my man. I remember hearing he'll grow out of it. It completely sets my dander up. There is No, and they realize this now more than ever. But when I hear it, it's still out there in that whole system, and it is so crazy. I mean, it's funny. I look like I'm sitting here like this. Anyways, I'm just noticing. I'm completely distorted. Like I have like this curve, but everything's opposite. There you go.
Costanza, like just got the Costanza butt wedge, and you're stuck.
Right. So when I hear that it's so irresponsible. I mean, just irresponsible. He'll grow out of it. That's another way for saying, I don't know why that happens, versus let's actually talk about objective scientific information to say, here's how we can assess whether your child is on track with his neurological age and stage, biological and chronological. And that's what you're saying, Dr. Wyss, correct?
Yeah, exactly.
Is that if we can measure reflexes along the way and they come online and then they go offline as the maturity is there.
Yeah. Go ahead.
Well, and I'm trying to set the stage for this for you. And so as that happens and we're evaluating a child, again, why I love what you're doing is you're bringing the logic and the science to it by saying, hey, I realize you guys see it this way. Doesn't matter. Here's what's really happening. Here's how we know. And here's how you, mom and dad, can tell whether this is working, effective, and if it's not. Yeah. And when you can assess a child appropriately, determine where their misalignment patterns are, where their tone is coming from, the lack of tone, and then you can address it and get that neurologic change and watch how brilliant and fast, absolutely magical a child is at healing.
Yeah.
Nothing like it.
Nothing like it. And that's why checking these reflexes are so important because, well, if you look at so parents if I say ATNR, they're not going to know what that is. But they are going to know that if the child looks to the right in their first 6 months of life, they turn their head to the right, their right arm straightens out and their left arm comes up. And then it does vice versa when they look left. Well, here's the thing with ATNR is that ATNR aids in one, allowing the child to stretch out and then roll over. But number two is it aids in crawling. And if they have a diminished ATNR, you're going to see a diminish in crawling and you're going to see a motor delay. And then that motor delay will lead to either a speech delay or further upper brain development delay, and it needs to be checked. So this is case in point. If you have a child that always looks to the right after they're born and they're always looking right, they've actually completely overused that reflex, and the reflex is already put away in the brain when it can't be put away until about 6 months of life. So then they're missing that amazing intricacy to develop this way and to look this way and develop, so then it allows their arms to push out and they can come up and then kick on another reflex. So if these reflexes aren't there, those reflexes slow down and now the child starts to delay, and it's really important that we check these. And it's the same thing with Gallant's reflex. That's the one when you touch the side of your baby's back and they kind of pull to one side and they pull to the other side. It's a cute response because you think they're ticklish, but really it's a reflex. Okay, yeah. Kind of like Palmer grass reflex, like everybody puts their finger in by the baby and he grabs it and he's like, oh, he loves me, he's grabbing my foot. And he can't let go of it, okay?
Right. He can't.
He can't stand you. He can't let go of it. He's like, oh my God, this finger is sweaty and it stinks. But here's the thing with this, is that that's another reflex that is there to allow their hand to grasp when they feed and hang on. And then as they get around 6 months, they can let go and they start to crawl and it becomes voluntary. But Gallant's is the other one where that actually aids baby in coming out of the birth canal, besides helping them learn how to crawl and move and inch along. Think about it. Everybody thinks that Gallant's is designed for a child to learn how to inch along on the ground. No, it's designed to help them get out of the birth canal, because it's designed along for them to move their shoulders, and as they get compression on their back, they start to inch one way and they inch the other way, and they move this way and they move that way, and they aid themselves out, right? Because think of how a baby comes out. They face the inside of the left thigh, and then they drop the right shoulder out, which is Gallant's left, so it's pulling it in, drops the right shoulder out, gets stimulated on the right side, and pops out his left shoulder. That's how it works.
In a healthy birth.
In a healthy birth. So when we have a child that's had a very, very delayed birth, or birth went on forever, or a mom said, I pushed more than 20 minutes, the 20-minute mark I get from Ina May Gaskin. Because I'm sitting listening to Ina May a couple years ago, and she's talking about the birth of horses and the birth of cows. Because Ina May is an amazing person. Ina May, for people who are listening, she is the godmother of midwifery. She's an amazing person. And she compared 2 years ago at the ICPA Wellness Summit out in Washington, D.C. She compared birth to that of a horse versus that of a child. And any time a horse or a cow spends more than 20 minutes pushing, the vet gets extremely concerned and is pretty sure that that animal is going to be a stillbirth.
Wow.
Yeah.
Interesting.
So why is it okay that humans push for more than 20 minutes on our backs? Okay. So, and the women are forced to be on their back versus be squatting or in all fours, which is what a doula and an amazing midwife can do and help them with, provided the hospital doesn't restrict them with not allowing the mom out of the bed or monitoring them and all that. But we're going to get on a different tangent there. But Ina May kicks that in. And how I tied that in right after that lecture is I'm like, oh, that makes a lot of sense, because Gallant's reflex, if it's diminished and if a mom is induced or put on Pitocin or the body's caused to go into labor before it's actually ready, that intrauterine constraint pushing down on mom due to synthetic contractions starts disrupting nerve communication right away in that baby. Beautiful. And that is not okay.
So I love it. That's an awesome explanation. You're just stimulating a lot of questions, which I knew you would, in terms of direction. So how does no, this is great. How does a patient, I mean, you got curious moms here. You got really moms that are already so on board. How do you, I mean, so let's say we're past 2 years old, we're past 6 months, you got different, you have different metrics you're looking at each stage of life. Now it's the infant is a toddler, they're 3. Yep. And you're getting to see now where they were stuck even at 6 months, but no one else in the medical system has related anything, because the child isn't showing major symptoms. They might already show like chronic ear infection. They might show food sensitivities. They might, spitting up, gas bloat, colon's off. They've just never pooped well, blah, blah, blah. And now you're the one to link all this stuff and go, no wonder these things have happened. And now they open their eyes. But how does the parent take some of this information, apply it to themselves, and just ask questions to go, what should they look for, and what do you do? 2 questions. What should they look for? And number 2, how are you proceeding around that 2nd year, 3rd year, just as an example? Okay. So like parents not knowing what to expect.
So we want to look at a really, really good history first. So from a parent listening, children should go in progression, rolling over to sitting up to crawling to walking to talking. And that should all happen from roughly 6 to 7 months forward, okay? And if they don't hit those milestones, and you notice that one of the biggest things is they didn't crawl. So either they scooted along, or they army crawled, or just pulled their arms. That's already a delay motor-wise. So for parents to think back through their child's development, a lot of parents remember if their kid crawled or not, because if they crawled, they were into everything, okay? Yep. And if they didn't, they weren't into anything. And then the next question is did the child talk before they walked? Because if they were already talking before motor came on and actually standing upright and moving forward, that's a delay in motor. So now we've got language online before motor comes online. And we need to be able, if we look at development, we need to be able to get away from situations before we can talk ourselves out of them.
Right. Right. So, well put.
Yep. So if you look at primitive wise, you need to be able to flee a situation and run away versus talk my way out of somebody trying to beat me up. Okay. So if they can already talk before they can get out of situations, they're behind. Now, from 2 to 3 years old, what I find is that once they're weight bearing and we actually have the stress of gravity pulling on us, now true imbalance starts showing up on the outside of the body. And that's where you're going to start seeing postural deviations in your babies. And you usually don't see them until they're pointed out to you. And the biggest thing to me is shoulder height, shoulder blade level, and head tilt. So when you look at your littles from the back, or let's start from the back and then we'll work to the side. So don't let me forget about talking about the side, Dr. Okay. So when we look at our babies from the back with their shirts off, look at shoulder blade height and shoulder level height. So the top of the shoulders, and then where their blades are, and you're going to see a change. You're going to see them leaning in one direction. That's a sign of imbalance. That's muscular imbalance. What runs those muscles? The nervous system runs those muscles. Postural muscles are directly ran by the nervous system. In fact, all muscles are. If muscles don't have nerve impulse or any sort of energy, they're just steak. They're just meat. And think of it when you're making a hamburger. If you add heat to meat, it turns into something delicious. If you add neurology to muscle, it turns into something amazing, which is called upright posture and fantastic life. Okay? So look at their posture. Look at their head tilt. When they're little, look at the crest of their hip bones. You want to make sure those are level too, and you're going to find that there's a deviation in those. Those are simple things that parents can do and look at how the child is standing. The other thing is that all children look like is a lot of kids that have bowel distress, and either they poop too much or they poop too little. If you look at them from the side, they're going to have a big distended belly. And at 2 to 3 years old, obesity really isn't running rampant. It can, but that's a different conversation. That's a whole different rabbit hole, which I don't want to get down, but we can at some point. But if you look at them from the side and their bellies stick way out, like we see with kids that are extremely malnourished. Well, here's the deal. A lot of kids in America are malnourished, even though they're eating every day. They're just eating empty food that's garbage for them, okay? But they're extremely malnourished, so their belly sticks out. But what happens is it's a tilt in their pelvis. And they get full of air, and they have a slow GI tract motility, which makes their belly stick out. So I have a lot of parents come in and be like, well, what about his belly? His belly's huge. His belly's full of air, and it's full of poop. It's full of fecal material, and it needs to get out. And this is why your kid either has a decrease in appetite and he doesn't want to eat because he's always full, or with babies, they're constantly spitting up or throwing up because they're filling up with air, so that GI is not moving correctly. So looking at them from the side as well, if they stick out and their butt sticks out like Beyonce or J-Lo, okay, and their belly sticks out besides the fact, they're like, shroom, and then their belly, so basically they got a bump in back and a bump in front. That's a that's a pelvis
tilt.
Miscommunication and a tilt. Exactly, it's a tilt. And it's coming forward. Well, what drives that tilt? Imbalance between the brain and the pelvis. Because it's trying to compensate for lack of communication. And that's when it starts showing up on the outside. And that's what amazes parents when you sit down with them and you just point out something in the chiropractic world as simple as posture. That's when you start seeing imbalances. And then we start going into, looking at reflexes. And in these kids that are 3 years old, if they still have reflexes that they were born with, that's not okay either.
Right.
Those should all be integrated by 6 months. STNR comes online right around 4 months. That's a little bit different situation. But all of those reflexes should be well incorporated at that point. And if we go to a kid and touch their face and they come over at your finger, or we touch the bottom of their lip and they come out and try to lick my finger, those are signs that their root and their latch reflex are still online. That's not okay. And that's all speech development.
And at what stage is that? So when it's not okay, because yes, we look for that up till.
Root and latch reflex should be integrated by 6 months. It should be voluntary at that point. Now, here's the thing. I have seen a slight delay in root reflex when kids are breastfed for past 6 months, which I highly encourage, by the way. Okay.
Yep.
Kids should be breastfed at least a year. So you're going to see that latch, that root reflex be there, but it will not be as strong as when they're 0 to 6 months. And it should be slightly delayed. It should be really light, and it should be pretty close to being voluntary at that point. Grasp reflex should be gone at 6 months. ATNR should be gone at 6 months. Gallant's reflex should be gone right around 6 months, because what comes online at that point, if Gallant's reflex is gone, they should be able to learn how to crawl. And that's the thing, is if you have a kid that's a butt scooter at 6 months and all they do is scoot on their butt and use one leg and scoot forward, they have a sustained Gallant's reflex on one side. These children often lead to bedwetting issues, or constipation problems. And the thing is a kid that has ADD or ADHD or learning difficulties has a sustained STNR. Now, that's another one that allows our head to come up and our feet to come underneath us when we start to learn how to crawl. So as parents, if they did not crawl, crawling is so vitally important to children and brain development, that if they did not crawl, there is a delay. And you could say that across the board. In fact, I will say it right now. If your child did not crawl on all 6 points, hands, knees, and feet, and crawl like a kid does, they are neurologically, they need to be checked by a chiropractor. There is absolutely no doubt in my mind a chiropractor needs to check that spine, because something is missing in that communication to allow for normal development.
And I have had adults that I have had to revisit their cross crawl reflex.
You have to.
And it turned out they're like, why did you ask that question? It's because I can tell the motor in coordination is not there. You didn't crawl much as a kid by the cervical curve and lack thereof with a good history that says they didn't have whiplash and it's not that kind of traumatic cervical spine. So the fact that they're open and willing to realize that and at least hear that message to go, this is part of why this is here. You've got an undeveloped area in your nervous system. And again, your body has compensated for it and hidden it. You've overridden and you're really strong on these areas because you're weak here to make up. But this is where now you're seeing the effects of that. Mm-hmm. Now that's an adult. And the goal here is that we can catch this stuff early and actually influence that child's life as an adult tremendously by the care and the assessment they receive and evaluation that's thorough, that's well versed, well documented, very objective, and quite frankly speaking, that's also the name of this, no pun intended, you're nailing the specifics of this. You're reminding me of reflexes that I don't always check because I've gotten some, I check several of these, but not all. And now you're just opening up, oh my gosh, I forgot about that one. And these are really vital. So that's really cool to be able to not only assess, but then be able to go, all right, well, here's what that means and here's why, and here's how you can influence it.
Yeah. And from a chiropractic perspective, that's a funny segue. Can I just use that as a segue? That's why Dr. Christina Stitcher and I developed the Prime Pediatric program for our chiros. Because there's a lot of things that when we leave school, and if it's a lot of docs, if they choose not to take the ICPA program, which I highly recommend, but I also highly, highly recommend the program that Dr. Christina and I have written, because it brings back in all of this stuff that we need to have in our exams. So we know that our neurology and what we're checking is bulletproof, and we have objectives to always go back to the well on. And it takes the dust off of everything we learned in school and then puts it in a very, very concise and packed pattern. So it's not taking us a half hour to do an exam. We have 5 to 10 minutes max to do an exam on a kid. Max.
In some cases, 5.
So getting through all of that is key. And being able as a chiropractor to get through it with the perfect amount of expertise for one, being extremely efficient for 2, and then understanding why, 3, understanding why we're doing it, and what those implications actually mean is key. A lot of the times from a chiropractic perspective, we understand what negative and positive is, but then at times we lose the ability to say, okay, this is negative. Why is this a problem? Or this is positive at this age. Where is the issue now? What's the problem here? And that's the one thing at times that can slow us up. And I mean that with all love. And I don't want my colleagues to be like that. I want my colleagues to go in this and be like, I know exactly what we're doing here, or why this system is off. So how do we restore health so this system integrates itself so now the body can then express itself better and work itself more and turn language on, turn vision on, turn hearing on, turn the immune system on, instead of always trying to shut things down. And that's the problem. That's the difference between treating an issue, treating a problem, versus actually restoring communication and allowing the body to heal itself.
Okay. Beautifully put. Eloquent. And yet, I want to ask you this. So can a patient with their 1 child, 2 kids, I mean, I see plagiocephaly like crazy. As you know, all different types of reasons that a child will come get checked. And then there's many that just never do. And you're like, oh my gosh, because their symptoms aren't necessarily bad enough, or they're getting their condition treated somewhere else for this, like ADHD, and they're on a drug. So you can't do anything for that.
Right.
So in other words, can a parent with their kid do both? Can they be treating a condition medically and actually functionally restoring balance with their child at a chiropractor's office? Is that a problem?
Absolutely, they can do that. That's called co-care. But also, if it starts limiting the neurology of the child, we have to reduce the deductive mechanism that's shortening the system up. So short-term, medicine works when it comes to short-term medications But when it comes to chronically taking care of someone's psyche, like if you have a kid with ADD, ADHD, and they're on Adderall or on Vyvanse or whatever they're on to help with their anxiety or help with their ADHD, long term, that is horrible. It's going to shut them down, decrease their appetite, cause weight loss, and cause neurological deficits and deprive them of sugar. That's what it's going to do, and it's caused a major problem with their brain. That's why these kids get up at midnight and binge eat sugar, because it's an appetite suppressant drug. It's a stimulant, right? Long term, horrible. Short term, in my mind, still really bad decision to do, but it's the only thing that's available. I understand why parents do it. But co-caring works wonderfully well. And MDs understanding that we're not trying to treat the condition. I'm never trying, when I work with my pediatricians in my area, or I work with my OBGYNs with all of their pregnancies that they flood our offices with, I'm not trying to fix the issue that they're working on. I'm trying to restore balance to the body so whatever they're trying to do works that much better. Beautiful. Love it. And so you can co-care, but in the long term, you have to figure out what's working and what's not. And when you're working in a deductive model, long term, that will never work. You need to be in a model that's building the body up and restoring health. And adding a pill to a system generally slows the health down. And that's not okay. So I think I'll reiterate for the lay there, what Dr. Skip, correct me if I'm wrong, is implying is that if you're just going to treat that symptomatic disorder and or disease or dysfunction with something chemical, and you're not actually addressing the structure of the body or improving function is another way to say that. I mean, that's why we're talking about two different things here. We're talking about an approach that actually restores balance and function to the body, chiropractic, and we're talking about something that treats a condition or disease. Right. And it doesn't mean you have to choose either or. I mean, you can work in that model. In fact, my recommendation is we as chiropractors, and then with, like Dr. Wyss is showing us, is that you work with alongside OBGYN pediatricians or an orthopedist if you're taking care of adults. And you have this relationship where the patient is the one that actually benefits by us working together as professionals rather than making the patient get stuck in the middle and feeling torn. Right. Because it is about that. It's how can we support the patient get better while they navigate maybe symptoms in the process, but actually start building health in that process to then move drugs and more invasives off to the side and allow them to be empowered as a human being. And that's what you're helping chiropractors with. Medication was never meant to be used long-term, ever. And if you look at any long-term study with medication, it always shows detrimental effects to the body. Always. So we need to work alongside. Old medical doctors never used to give as much medication as they give now. In fact, the American population judges their medical visit on whether or not they got a medication or not. That's what they consider success. I consider it a success if I ever go into my MD and he says, go home and take vitamin C, you have a viral infection. I'm like, all right, good. I don't need this garbage. But test me, figure me out, do a swab, check my bacteria levels, take my blood. Let's figure this out so we can go about this two ways. But always, if we're seeing delineations where we need medical help, the body is under stress and we need to relieve that stress internally. And the only way to properly do that is to have the brain talking to the body properly, therefore decreasing neurologic stress. And if neurologic stress is decreased in children too, if the brain is not constantly trying to communicate to the body, it's not communicating back. We've all been in that relationship and those suck, okay? Where one side talks and the other side doesn't talk. And that's what your brain feels like when the body can't talk back to it due to subluxation. Then the brain gets hyper-stressed and then everything else decreases in function because of the brain not being able to properly communicate and control the program that's going on with the body. Cortisol goes up, stress chemicals go up because of that. Okay, cool. We could keep going, but I respect your time as well as listeners. What, if you would, this is kind of dropping a bomb on you just a bit, but the top 5 things a parent could look for as to know when it would be a good time to get their child. I mean, we already kind of talked about ideal,
have your child checked, have mom checked while she's pregnant. If you're not getting pregnant, get checked by a chiropractor. All of a sudden you become fertile, all that stuff works better. Backtracking. So now through the birth process, more efficient birth. I don't want to take away thunder there because that's a big deal just in terms of pregnancy. But now you've had the child's 4 months old or 2 years old, and now you're seeing this, or you're just becoming more and more aware. What could a parent look for to know outside of ideal? Give me 5 things they can take away and go, how would I know my kid needs to be checked by a chiropractor? And that it's like time. Okay.
So symptoms wise, let's split that in 2 categories of 5. Okay.
Good.
Symptoms wise, chronically sick, you need to see a chiropractor. Chronically sick. Constipation or diarrhea or bowel issues, not a good thing. I call it the 3 C's of childhood: colic, constipation, can't sleep. If your child is not sleeping, that's number 4. We need to be seeing a chiropractor because the body's literally not shutting itself down. So, and then we have digestive difficulties after that with constipation, and if they're not eating properly. Those are the top 5 things. So let's recap that because that came off my head, and I'm sorry.
Yeah,
man. So the symptoms base wise, colic. Okay, so they're constantly spitting up, acid reflux, lots of tummy trouble. Okay, that will lead, and then if we have always sick, so constant ear infections, snarfly, always got a runny nose, eyes will always look like they're being punched in the face, like that's the immune system. Okay,
histamine.
Yep. Next one is bowels and constipation. Okay, did I get that already? Nope.
You're good. That's 3. Yep.
And then I would look at inflection, bowels, constipation, speech development, and if they're on task and actually talking and hitting them, they should be talking by about 14 months max. Okay. And making good verbal sounds and all of that. And then I would actually look at if they're around 2 to 3 years old, check out their posture and see if they're distended or not. See what's going on with that actual, what's looking at from the outside looking in. Take that outside approach first. That's going to help you want to get the inside checked out.
Good.
Now,
awesome.
As far as, I think that's where I want to leave it because I could go down another rabbit hole, but those are probably the 5 simplest things to look at from a childhood perspective. That is huge. If you have a newborn, the other 5 I would look at is latch. If the baby can't latch and they can't stay to breast in that first week of life, they need to be checked by a chiropractor. Secondly, head position. If they're always looking in one direction over the other, that's not a good thing as well. Body position when they're laying down on their back. If they're always in the shape of a C from the side, so they're always leaning right or always leaning left, that's a serious problem. And again, colic and constipation or lots of diarrhea. If that kid is pooping every time they have like a urinary, so if they pee and they poop all the time, like they're consistently together. So if that kid's soiling 12 diapers a day, half of those are probably sharts, and that's a bowel problem.
Yes.
Parents see constipation when they can't poop, but if they're pooping nonstop when they're little, that again is a bowel issue too. That's a water thing.
Would you put, by the way, these are awesome. And so I know that stimulated an idea in your head, right? Like you have these somewhere or they're going to be soon.
Yeah.
Because if these were right off the top of your head, but skin, would you put skin into that? Because obviously digestion
eczema
is right around that digestion, bowel, constipation point.
Yeah. Eczema is a liver issue and a digestive problem. So if we see things on the skin, remember, skin is the largest organ in the entire body. And that's how the body gets rid of everything and detoxes when it's literally either sweats it out, pees it out, poops it out, or it's coming out through the skin with sweat, or it's coming out dry. And it'll come out in the form of a rash. But if that rash stays long-term, like in eczema where we see it in our crevices, in our knees, in our elbows, in our armpits, along our face, that's all signs of a digestive issue or a liver problem. But more importantly, is what controls the liver and what controls the digestion. And if we can get that area back into control, then we can start looking at nutritional issues as well.
So I'll reiterate what I think Dr. Skip just said there is even though he mentioned liver and digestive issue, he's saying functionally we affect it through the nervous system first, and we can influence it just like that alone, just by making sure. I had a niece that came in. I've got like 29 different nieces and nephews from a big family here. And I remember one of my nieces came in because my sister lived an hour and a half from us, and she came into my office, got her adjusted, and she was jaundiced. And I'm like, she's 6 weeks old. Why am I just seeing this now? How long she's been jaundiced? And my sister basically said, because family's the toughest, by the way. God bless her. I love her. So this isn't a judgment on it, but this is how it goes. She's just been jaundiced this whole time. I said, why am I just now seeing her 6 weeks later? And I adjusted her. This was her first adjustment. And she literally turned pink within seconds, within the first minute. And it was just so awesome to see how quickly the body works. Now, did I, for sake of legality and disclaimers, did I cure and fix her liver? No. Did I adjust her body and influence how things are functioning? Yes.
Exactly.
That's what Dr. Skip was referring to. So we look structurally first, neurologically, and then we support with nutrition and anything needed outside in but in most cases, what I've seen is the baby's nourishment then starts to get into the system. It's not like they weren't getting nourishment provided for them. They just haven't been able to use it.
That's how I talk nutrition with all my patients, because now a lot of chiros are doing nutritional testing and functional medicine testing, which I understand. But in my mind, it's neurology and communication first. And we need to get the gut working with proper nerve communication so we can actually start assimilating and pulling across what needs to come across. And if that's not that's exactly how it is. And that was kind of what I was trying to get to in that liver comment. But we need to get the neurology, the communication online first. And if
you did say that, it's just that you're used to speaking to docs, and there's a bunch of patients here. So I'm like,
it's getting that to absorb. You have to get their gut to work, and that the brain is what controls the gut, bottom line. And the gut needs to pull stuff across. And you know what's funny is your story about your niece with the jaundice sounds just like it was your niece, right?
Yes.
Yeah, my nephew had the same issue, and except I was there within hours of his birth. I drove 8 hours to go see him in Wilmer, Minnesota from Green Bay. I did it 16-hour drive in one day. And when I got there, he was yellow, like yellow. And his APGARs were off. And it was a good situation. We cleared his nervous system, and within seconds, he went from yellow to red, like just bang. And he got red hot. It was amazing. But it was his nervous system coming online. And
right.
It's just like what you're talking about, except yours was farther down the line, which I would be even more worried about. And that's cool. We have a very similar story there. And I bet a lot of chiros have a story like that.
Yeah, it's cool. I mean, the body's, and I think that's where there's some real distinction here. It's not that chiros are trying to fix or cure anything. That's not what this was about. It was about how do we support health, and the body's response is the body's response. But when the ability to heal is inside out, as you'd stated, and we all experience, it's saying it in one breath, but not owning it in the other is like, well, yeah, my body's supposedly self-healing and self-adapting, and yet I have to do this. So I can't we don't oftentimes find that sweet spot as patients where we're all in, like, wait, if this is the way it is the way it is. We can still support from outside, but we also got to understand that it's going to happen if we give it a chance.
Yeah, it is.
It's just giving it a chance.
We have nothing to lose. As parents, we have nothing to lose, and we just don't. And a chiropractor that knows what they're doing with children and has been doing it for years, has their certifications, has their has their confidence, you have nothing to lose as a parent.
So, Dr. Skip, where can people find you? Is there any last words you want to share? I mean, what do you want to, not that they have to be the last words, but for today?
That's funny. Yeah, they can find me at, if it's a chiropractor looking for me, they obviously can go to Wyss, WYSSclinic.com. That's our office website. The Pediatric program.com is the pediatric-based, chiropractic-based training that chiros can get into. And parents can always try to find me on Facebook. I'm Skip Wyss DC on Facebook. They can find us, follow our office, Wyss Family Clinic, Wyss Family Clinic of Chiropractic. I mean, that's where they can find us. And you can call my office. That's 920-468-4199 if you need to chat with me. It might take a little bit to chat with me, but that's the way it is. And that's where we're at. And leave it with one quote here. In the genius's life is that of a guy that never loses his ability to be a child. That's true genius. And I think that's why men are always happy-go-lucky, because we never stop being kids.
Yeah. Some of us can take life too serious at times.
Yeah.
And yet we can also be called a little immature at times, because for reasons of like having fun and being able to relax and, kick back, whatever. But I love what you're doing, Dr. Skip, and I completely value what, in your approach, how you're doing it. So number one, I want to thank you for your time today, and very appreciative. I know you dropped some huge value for my listeners, our listeners, obviously your listeners now as well, because I want to share this back. But I just think it's profound when someone like you jumps in and starts, first of all, you want to help the profession. That's a big deal, as do I. That's part of why I connected with you right away. Your energy, enthusiasm, and your certainty with it is awesome. So I know your patients love you, and I don't have to really know any of them to know that, because of your commitment to them and the fact that they're in just great hands. So I will see you down the road for sure, whether it's even Prime Pediatric work, which I'm really looking forward to the launching of those. And obviously check Dr. Skip out. If you have questions, follow him on Facebook. You can find him. He's obviously contactable. He opened the door for that. And if you have questions, whether you're a chiropractor, another professional, whether you're doula, whether you're a midwife, we are completely into that as chiropractors, because we support a natural birth to a child. And this is also that evolution of how do you take care of them drugless and keep them functioning well. Dr. Skip's an expert at that. So thank you so much.
Thank you very much, Dr. Wade. I really appreciate it. And congratulations on the CSW, man. That's awesome.
Yeah, well, we're growing. Yes, happy 7th birthday. Yeah. So I wonder if we have premature reflexes still hanging around.
Only the good one.
Yeah, we'll see. Every challenge, there's challenges with all growth, right? And we definitely have our growth challenges with this association as well. So nonetheless, thank you so much. And for all you listeners, this podcast will be up in probably a week or so. So enjoy. And Dr. Skip, hang on.
Thank you.
Thank you much for listening to this week's episode. I look forward to any feedback and or questions you might have. Direct them to our Facebook page, Frankly Speaking, Dr. Wade at Facebook. Okay, my fellow health warriors, it's time to head over to iTunes, franklyspeakingdrwade.com. There, you can rate, review, and subscribe, as well as share, so more of our brothers and sisters can grow to realize their voice. Speaking up means you matter. So, get on it. This podcast is for information purposes only. The statements and views expressed are not medical advice and are not meant to replace the medical advice of your doctor. This podcast, including Dr. Wade Annenson and his guests, disclaim responsibility for any adverse effects you may experience from the specific use of information contained herein. Opinions of guests are their own, and this podcast does not endorse and accept responsibility for statements made by guests. This podcast does not make any representations or warranties about the guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for such services or product. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.